Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And I am so excited to welcome today Ginger Breedlove. Welcome, Ginger.
Hi, Kristen.
Oh, it's lovely to have you here. You are going to be our speaker for the International Day of the Midwife presentation. We're celebrating here at Gold on May 1st, and you are going to be presenting on midwifing, the midwife key elements to scaling up and sustaining our workforce. I can't wait for that. But before we hop into all of this, talk a little bit about yourself, Ginger, and your background for us here.
Sure. First of all, it's an incredible honor to be asked to speak on a very important day. And I think as many of our listeners are well aware of, midwifery in my 47-year career is probably being talked about now more than any other time that I've been in practice. And uh, it, it's interesting. It's an interesting time where the workforce shortage has been challenged post-COVID. Healthcare providers are exhausted. Families are now increasingly anxious about the media related to maternal mortality and severe
Yes,
events. And midwives are sort of in the middle of this perfect storm without there being enough of us. And so it's exciting to talk about not necessarily specifically self-care, but how we care for our profession and
hmm,
the variety of ways we come into the profession. And it's been a platform of mine my entire career, that the role of midwives in how we amplify the needs of the families we care for is not to replace or better than any other model, but it is a model that has a whole person viewpoint and really is inclusive of everything around the pregnant person, right? Not
right,
just the state of pregnancy, but our style of evoking an understanding and trust related to all
right.
the other things that influence the pregnancy event. So it's exciting to share some of my vast experience nationally in particular in the past several years, but also um, wins that I think we have to identify to help us keep going.
Absolutely. You talked to so many important points already right there about, we know that women's health care is in crisis in many countries. We've seen mortality and morbidity, infant and maternal increase in the United States instead of going down in recent times, right? And we know, however, that the midwifery model of care, it works, right? It
Right,
really, really works. As you mentioned, it's inclusive, it cares for the family, it is really working. Yet, midwives feel more and more unsupported, stretched to their limits, under
right,
attack, isolated. And we talked about that a little before we came on here today.
right,
And and many of us are feeling like isolated,
right,
right?
right.
And many are saying, yes, I want to fight more, I want to be there,
Hmm.
but I feel depleted. And especially
Hmm.
after coming out of COVID, I feel
Right,
like I can't even take a breath, and it's it's relentless. So we need to look forward to specific, and I love what you said earlier, there wins as well,
right.
because I feel like this is something that can really motivate us and keep us going. Talk a little bit about that side as well, because
Sure,
I feel like this is we need this. This is more than
sure.
ever, we need this.
In the work that I do on a daily basis, the typical breach is a hospital health system or a midwife or a client that's looking for how to do something to either start, improve, or scale up midwifery. And
Mhm.
oftentimes they're coming because they don't know what to do. They've
Mhm.
searched, they've spent some time trying to find ways to get answers they need. But oftentimes I learn that it's not because the person hasn't tried or they don't care, but they don't know what they don't know. And
Right.
then we begin to fill the void with assumptions and fallacies. And oftentimes helping people break those fallacies down is the first step to education.
Mm-hmm.
And it's not just about data, right? It's not just
Mm-hmm.
about statistics or about money, but having the voice of the people impacted is equally important in these conversations. What are the consumers' fears? What are the consumers' desires? That's changed really on, I would say, a lot since COVID, but it had been changing before.
Mm-hmm.
And now that, thank goodness, more people are aware, but not enough, that maternal health is a crisis globally, and in
Mm-hmm.
particular in the US, is the worst of all high-income countries, families are scared.
Mm-hmm.
And if a midwife's encumbered by barriers, then that overlays their ability to provide the care they want to provide
Right.
and feel protected, whether that's legislatively, legally, through malpractice, being
Mm-hmm.
reimbursed equitably. The issues just are compounding. And so one of the things that I try to say is just pause for a moment
Mm-hmm.
and think about one or two small steps towards change that can be achieved fairly quickly to begin to develop your own sense of empowerment and control before you try to conquer a state issue, or a
Right.
payer who doesn't want to
Mm-hmm.
reimburse you. You have to build confidence to be confident. And
Mm-hmm.
you can do that alone, but it works much better with diverse groups of people who will come together, perhaps not understanding quite yet at the first meeting why they're coming together, but by meeting 3, 4, or 5, the common cause is defined with clear steps to move forward. And that takes time.
Mm-hmm.
If you
Mm-hmm.
don't have some wins along the way, people get discouraged and give up.
And give up and leave the workforce. And that's
Yep,
a really,
yep,
really, what we've seen happening, especially during and after COVID, that many, left saying like, I
yep,
can't do this anymore. And the key to what you're saying is, from what I understand, it is, take little steps, but also don't do it alone, right?
right,
Be
right.
it, yeah. Where can people find this kind of community or help,
Well, we're going to
well,
talk about that during the presentation because I can give you a few ideas, but there's so many and
mm-hmm,
perhaps wider than our lens has allowed us to think about. But
mm-hmm,
it's amazing the power of social media, and not just talking to midwives, but
right.
putting out opportunity for people who are families who have a friend who knows someone. Just happened in Kansas, where we're having a major stakeholder meeting in our state on liability issues. And one
Mm-hmm.
of our midwives is dating a person who personally knows the governor of Kansas. Now, how did we find that out? Through trying to intentionally build the network of diverse people. And
Mm-hmm.
when you think about opening up your conversations beyond our silos of what we know to be true, we begin to realize there are other people out there who can help us. And I think it's hard to do when you're tired, you're overworked, you have a
Right.
family, and you that's the last thing you want to do is to try to go tackle a barrier. But it
Mm-hmm.
is the way things happen faster,
Mm-hmm.
and likely with more success. Is the more people you gather that are diverse, that come together, the more likely change will occur.
And that's what you're here doing right now for Gold at that presentation. And this presentation for the celebration of the Day of the Midwife is free and open to everyone. And we want not only midwives to come, right, Ginger? We want
Right,
everyone to come, because this is
right,
something that is important to everyone. And finding that diverse, group of people who
right,
maybe know somebody who knows somebody, or maybe
right,
has some inputs and ideas,
right.
so this presentation is not just for midwives, or, but anybody who's interested in the topic and maybe participating and being a change maker or just contributing, right?
Exactly.
Absolutely. One question I have for you, I was thinking about this. It's like midwives are very good at what they're doing. They have their clinical skills, they have their skills, caring for families, really listening skills. But what
Hmm.
skills do you wish midwives and healthcare providers in that area would develop or could learn
Mhm.
to really help them achieve this positive outcome, or be, be more confident, as you
Yeah.
also mentioned.
It's not just confidence, but it's the art of persuasion. And that's a
Ah.
very easy question to answer. At the ripe age of 68 and 47 years in the practice, I took a Harvard course on negotiation this past summer, and it enlightened me in ways that a college debater didn't quite learn, which is how you negotiate in conflict. And we're not really good at that. We
Mm.
we 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 can bring the data, we can talk about facts and numbers, but the art of persuasion when there's difficult conversations or high conflict is a skill. It's a skill
Mm.
that can be learned, and I'm actually going to highlight on some of the slides how to do that, and a fantastic resource called Getting to Yes on sort of the toolkit to learn how to do that. But we have to be stronger in our persuasion skills to get people to listen to us effectively.
Absolutely. Oh, wow. That's such a wonderful, wonderful advice there, right? And quite, different from what we learned, for example, in midwifery school,
Yeah,
or,
exactly.
in college, and on our way to becoming midwives and healthcare providers in general. So that's a fantastic news. You are helping midwives as well. Talk a little, just briefly, about what you're doing in your
Sure,
business for the community as well.
sure. I appreciate the honor, Kristen, to say a few things about Grow Midwives. I started this consulting group 6 years ago here in the US, based in Kansas. Um, and the purpose was really to fill a gap of helping midwives and places they're employed in, businesses they want to start, education programs that wanted to grow, to be able to be a resource. And our team has grown. It's quite diverse. The past president, two-term of AABC, is one of my partners. We have an attorney who's written more on midwifery in the US than anyone else, who happens to be my husband, who's a partner. We have a maternal fetal medicine physician I worked with for over
Fantastic.
10 years, whose
Mhm.
master's in public health while he was becoming a doctor was the traditional midwife successes in the Boot Hill of Missouri.
Mm.
Um, we just have a tremendous depth and breadth of our team, providing buckets that really intersect all areas of midwifery, whether it's an individual midwife looking for coaching and contract help, or a health system wanting to start a midwife service. We're there to do it.
Wonderful. Thank you so much. Thank you so much, Ginger Breedlove,
Sure.
for spending time here with me, talking about the wonderful presentation you have here coming up and about the work you're doing in the community. Thank you so very much.
You're welcome.
And now some information for our viewers. If you would like to sign up for this presentation here, Midwifing the Midwife, Key Elements to Scaling Up and Sustaining Our Workforce. This is the presentation where we celebrate the International Day of the Midwife on May 1st. You can do so at goldlearning.com. And as I mentioned, this presentation is open to everyone. We welcome everyone to attend this presentation. It is also recorded, so make sure you share this with your friends and colleagues in the field. Thank you, everyone, for watching, and thank you again, Ginger, for being here today. Bye-bye, everyone.